Hello everyone, myself is Sadaqat and I've been associated with academic writing in MyAussieTutor since the past 1.5 years. I have a bachelor's in dentistry and a master's in public health, and today we are going to discuss evidence-based practice and how evidence-based practice helps improve outcomes for pediatric asthma children and asthma patients. So, first of all, we begin with the PICO question or the research question that we have developed. PICO in this case is the methodology of writing the question, where P is the population that has been chosen for the same, I is the intervention that is being applied or checked, C is the comparator to which the intervention is being compared with, and outcome is the outcome that is being assessed, whether what are the changes to the outcome that have been seen as a result of the particular intervention that has been applied as compared to the comparator. So the question for the research that is chosen is as follows, that is, in hospitalized pediatric patients suffering from asthma, is formal nurse-led asthma education better at improving asthma management and reducing emergency department visits when compared with the usual discharge instructions? So in this case, our population is the pediatric asthma patients who are hospitalized suffering from asthma. The intervention is specific nurse-led asthma education. The comparator is comparison that has to be done for the intervention is the usual discharge instructions that are given. And the outcome that we are assessing, if it is better or not, if it is changing the outcome by reducing emergency department visits for children and improving their asthma management. So two things as an outcomes are measured: reduced number of ED department visits for children, for pediatric asthma patients, for hospitalized patients, and improved asthma management, reduction in the hospitalization and ED visits, and improved asthma management. Moving on, what is the search strategy that we applied? The search strategy was started basically by breaking down the research question into a PICO format as we discussed previously, and then using the keywords that have been broken down along with Boolean phrases, and then using this combination as a part of the searching strategy. So the keywords were as follows, that is, hospitalized asthmatic children, pediatric asthma patients, two things. So the phrase would be hospitalized asthmatic children or OR capital pediatric asthma patients, followed by intervention and asthma education, or nurse-led asthma education, or formal asthma management, and capital A and D as a Boolean operator, usual discharge instructions or follow-up instructions. Then using capital A and D and Boolean operator, reduced ED visits, or 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 Boolean operator, improvement in self-management, or OR Boolean operator, or increased school attendance. So this is the keyword, the search strategy that has been developed, where all the research format and the PICO format has been broken down into specific keywords and the alternatives that can be used for those keywords as well, and the Boolean phrases that will be used for after the population description and will be used to describe the intervention. Then another and to describe the comparator, and capital A and D Boolean operator to describe the outcome. And all the similar words or similar keywords associated with the specific headings, that is population, intervention, comparator, and outcome, they will be used or collected together by using the Boolean phrase or. So hospitalized asthmatic children or pediatric asthma patients, that is your population part covered. Then you're going to use a Boolean operator and capital A and D, and then discuss the intervention, which is asthma education, or it could be nurse-led asthma education or formal asthma management. Then again you apply Boolean operator A and D and you discuss your comparator, which is usual discharge instructions or follow-up instructions, and again A and D and to describe your fourth PICO format of this thing word, that is the outcome, which is reduced ED visits or improvement in self-management or increased school attendance. So we use similar words or synonyms of all the format keywords for each heading under PICO, and use and as a Boolean operator for connecting all the four headings of the PICO format: the population, the intervention, the comparator, and the outcome, as a part of our search strategy in our database. So whatever databases that have been chosen for conducting the search, those keywords will be entered along with the Boolean phrases in the search box of that particular databases, and then the search will be conducted. So the databases that were accessed, that were selected as a part of the search strategy, included Sinhal, Cochrane, EBSCO, Medline, and PubMed. Why were these specific databases chosen as a part of search strategy? Because high quality evidence should be used in evidence-based practices to give it a better clarity and validity, and also evidence-based search using high quality databases from Medline, PubMed, and Cochrane helps in establish the credibility and accuracy of the evidence that has been selected, and it also helps develop a better understanding of the evidence base for the intervention. Also in narrowing down and broadening our search as per the requirement of clinical practice. In this case, we are narrowing it down to specific pediatric asthma patients and reducing ED visits in them by giving proper formal education to them at discharge time. So that is, we have narrowed it down specifically to pediatric asthma patients and their reduction in ED visits and asthma complications or asthma exacerbation because of improved management of the condition or situation by themselves. So this narrowing and broadening down of the search basically helps develop a specific understanding of the evidence base, and as per the requirement of the clinical practice, you can do whatever you want to do as per your requirement, either narrow it down or broaden the search. And also, if you're using high quality evidence, then it will give you help develop better clarity and validity of the situation of the evidence based search that you are conducting. And also, if quality databases are used, then appropriate credibility and accuracy of the evidence that has been selected will also be achieved. So this better understanding of the evidence base can be done if you are accessing accurate databases that are giving you high quality evidence in and along the hierarchy of evidence of the specific types of research articles. So the literature that was accessed, I'm going to give you a simple example of the literature that was accessed. First article that was selected was about poor asthma education and medication compliance associated with increased emergency department visits by asthmatic children. A very specific article that was selected for the same. And then the other article was emergency department visits for children with acute asthma, discharge instructions, parental plans, and follow through of care. A prospective study was conducted on the same issues to check whether the discharge instructions, parental plans, how effectively are they working in cases of children who are discharged. Then case worker assigned discharge plans to prevent hospital readmission for acute exacerbation in children with chronic respiratory illnesses such as asthma. So that is a Cochrane database that was used in this case. Then there was another article that was chosen again from Cochrane, which was school-based self-management interventions for asthma in children and adolescents. It was a mixed method systematic review, highest quality or level of evidence that there exists is a systematic review. And if it is a systematic review of RCTs, it is the highest level in the hierarchy of evidence. And if it is a systematic review of mixed method, qualitative, quantitative studies together, then also it is a high level or it is a high level evidence in the hierarchy of evidence, but not the highest. The other article that was chosen was Integrated Care Initiative to improve the management of pediatric asthma. This is also a similar thing to basically check whether the pediatric asthma can be handled in a better way if you are doing an integrative care initiative or integrative care management, or if you are doing school-based self-management or improving providing better education or discharge instructions to the individuals, to the children. So can they reduce the readmission rate? Can they help reduce the acute exacerbation in children, or can they reduce the emergency department visits for children suffering from asthma? So all of the articles chosen have been in the similar premise and have been used. So the analysis of the findings after selecting these articles was that, according to one study, the majority of patients had little understanding. Almosen et al. 2015, the first study that was chosen, that their children had little understanding of asthma and were missing medicine, misusing them, implying an ineffective treatment action plan. Therefore, excessive and frequent trips to the emergency room were very common. They were linked to a lack of asthma education and medication use. So potential healthcare system flaws in sending patients to the appropriate medical institutions were discovered, highlighting the need for improved illness information to be given to the children, to their parents and their guardians as well. So that improved medication discharge instructions, or given in a better way, or improved education regarding asthma treatment if given at time of discharges to children and their parents, it will lead to decreased number of ED visits and visits to the emergency room for the children and the patients as well. Another study showed that formal asthma education in children and parents has been said to improve school attendance and also reduce hospitalizations associated with asthma attacks. So Camp et al. 2014, the article chosen depicted precisely that. Another article by Hall et al. That we discussed showed that caseworker assigned customized discharge plans may be more better than conventional discharge plans in reducing the rehospitalizations of acute asthma exacerbations in children. There was no clear evidence that the therapy reduced asthma emergency room and general practitioner visits, and there was no evidence for children with other chronic respiratory diseases, but there still was a direct connection between reducing rehospitalizations for children. And then there was another systematic review conducted by Humera et al. 2019, a Cochrane systematic review that showed that even though the influence on school enrollment could not be consistently evaluated, school-based asthma self-management programs definitely help reduce hospital admissions and ED visits modestly. They could also lower the amount of days the children have these asthma symptoms, and they will almost certainly result in small adjustments in asthma-related standard of living, as was shown by another study, Harris et al. 2019. So moving on, we can specifically conclude here that several of the studies that have been found, they looked at the intervention in the younger children from low-income families. Interventions having a theoretical foundation involved parents and were conducted outside of children's free time, and they were shown to be more likely to be implemented successfully. Given the possible rewards and cost saving to the healthcare sector and households if hospitalizations and outpatient visits can be lowered, more RCTs need to be conducted on naturally different severe respiratory ailments, so that and children belonging to different ethnic backgrounds and also among children belonging to different socio-economic status settings, so that the cost efficiency of this methodology as well as establishing the critical characteristics of the complex intervention are done and are established. So that's it. I hope you have understood the entire evidence-based practice of how it's practiced and how it's done, and how we can reflect on this experience and develop your understanding of research skills, and how you conduct a literature review, and how credible sources can be found out from different databases and searched, and how you can better your skill of conducting research and developing search strategies as well. So that's it for today. I'll see you again in another session with another topic. Thank you.